So, most people that get hypertension, also known as high blood pressure, will have primary or essential hypertension, which both mean the same thing. So, let's start with the heart and the vessels. So, when the heart beats, the highest pressure the walls feel in the arteries is the systolic blood pressure, or the top number, okay? So this is the systolic blood pressure. Systole is just the name of the phase when the heart muscle contracts and comes from the Greek word systole, which means to contract. When your heart relaxes, right after it beats, your artery, what the pressure is in the artery is the diastolic blood pressure, and that's the bottom number. And so typically you want the top number to be 120 and the bottom number to be 80. And so essentially high blood pressure is the plumbing being squeezed, so it makes it harder on the heart, right? So if you imagine a hose being squeezed, well, everything behind it gets the fluid accumulates, right? And so now the pressure coming from the valve is going to increase because everything is just being backed up. And so that's kind of a simplistic way of thinking about high blood pressure. So in this case, the fluid's getting backed up, and now it's going to be stressful on the heart, right? So if this is being clamped down, all of this is being clamped down, now it makes it a lot tougher for the heart to pump blood into these tight arteries. And so that's the essentially the biggest problem with high blood pressure. So there's a few reasons why this occurs. One is that there's an overactive sympathetic nervous system, right? So the sympathetic nervous system is responsible for the fight or flight response. And so when you have this fight or flight response, you generally have a faster heart rate, you start sweating, you can have the arteries getting clamped down in certain parts, so it can be rerouted to the muscles. So this is okay for a fight or flight response, which is typically a short duration, but it shouldn't be active all the time. And so one of the reasons for primary hypertension or essential hypertension is that this could be somewhat higher than baseline in some people. And this can be due to genetics, and it can also be due to different factors that I will go over. Another theory is that you have a higher activity of the RAS system, right? So the kidneys are also involved in this system. And once again, if your kidneys are too active, you can absorb too much salt, and then water follows salt. And so that can also lead to increased fluid in the arteries, and also the kidneys can excrete a hormone called aldosterone, which can also clamp down on the arteries, also causing excess stress on the heart. So these are the two main theories of why this can happen, but it's still a very complicated subject matter and still being researched. But the overall effect is the same. It makes it tougher on the heart because you're clamping down on the arteries and you're increasing both of these numbers. The pressure that the arteries are feeling when the heart is contracting and it's pushing blood into the arteries, and also the blood that's there when the heart is relaxed. And so what's the point of all this, right? What's wrong with hypertension? Well, the thing is that if these arteries are feeling pressures that they're not supposed to feel, right? If this number's not 120 and if it's higher, like 180, well, that's okay for the short term, but in the long term, these vessels were never designed for that kind of power, right? Essentially the same thing as the hose analogy. So essentially, if there's so much pressure, yeah, the rubber can distend a little bit, maybe for a short period of time, but if it's constantly like that, then the hose is going to get destroyed in the long term. Same thing, you're just going to wear out your body quicker if it's constantly under stress. And so there are certain risk factors that make hypertension worse. So a few things are excess salt, smoking, obesity, alcohol, and lack of exercise. All of these things can increase your risk of high blood pressure. So let's talk about salt, right? So the dietary guidelines for Americans only recommend salt to be 2,300 milligrams per day, which is essentially only 1 teaspoon. So that's pretty small, and essentially you can easily exceed that if you go out to eat anywhere. So if you go to a restaurant, I can almost guarantee you that a meal will exceed that 1 teaspoon limit, and you'll quickly go over it. And it's a common tip to always check the nutrition values to make sure that you're trying to limit as much salt as possible, because sometimes you don't even realize if food is salty. Like, for example, some breads at certain places have a lot of salt, and you might not have even noticed it. And so an easy assumption to make is that if we're eating a lot of salt, drinking water would simply flush it away. But that's not necessarily the case. Our bodies have been adapted to take advantage of salt because back in the olden times, salt wasn't as available, and so that's why it's so addicting, because it was so rare in nature that we needed it to be addicting so that we would crave it. But now that it's plentiful, fast foods have taken advantage of that, so that now you can quickly add salt to a meal to increase the taste and make it more addicting, so a better product. But in the consequence of that is now it's very harmful to our bodies in the long term. So the easiest way to fix all of this is to decrease these risk factors by not eating out as much, trying not to eat as many canned foods that have high sodium content, and trying to eat more fruits and veggies, and exercising. This is tough because we have pretty busy schedules, but if you take these measures, you can help reduce the impact and help get it closer to this ideal goal. And then if those things don't work, you can also resort to medications. But this video is really just a simplistic video talking about the overall concept of high blood pressure. And then the final question is, why should you care about high blood pressure, right? Because most of the time it can be, for example, 160, but you won't really notice it. So what's the point? And most people don't even realize it until they go to the doctor's office. And a small caveat to that is there's a thing called white coat hypertension. So most people think that their blood pressures get higher, and they do when they go to the clinic, because when they go to the clinic, their sympathetic nervous system can become activated, and then you have higher blood pressures, and so it can look falsely elevated. And that's why the doctor will usually ask you to record your blood pressures for maybe 2 weeks, 2 times a day, in the morning and evening, to see your baseline level, and then we can think about changing medications or adding medications or starting medications. And so that's definitely a real phenomenon. But to go back to the question, why should you care? High blood pressure is important because, as I previously mentioned, you don't want your vessels and your heart especially to wear out, right? If it's only meant to be at these numbers, but if it's consistently higher, you're wearing out the parts, right? You're stretching to the point that it has to be remodeled, and that's not good, because when it tries to adapt to higher blood pressures, that's when you get plaque formation, you get thicker arteries, and then that can lead to things like heart attacks and strokes. And so if we can all do stuff to reduce our risk of that, then we can help reduce those causes of death. And so this was a very simplistic video that I just wanted to introduce the concept of hypertension. I hope it was helpful, and thank you for watching.